doesn't
do it.
guarantee affordable,
And this
but
is
they're
where
not getting the
policies
benefits
lower
for their
We're joining ACA this week from our Voices from the Field webcasting series. We're here talking with Ron Pollock, Executive Director of Families USA, a national consumer healthcare advocacy group. Professor John McDonough is moderating.
You know, for people who are uninsured right now, I would say there are two top priorities that relate to the Affordable Care Act. And you know, one is we've got in 25 states across the country, we still don't do anything for the lowest income folks because the Supreme Court changed the Affordable Care Act's provisions relative to the Medicaid expansion. And that's a big, big ongoing fight. If you look at the states that from Texas all the way through Virginia, not a single one of those states has expanded the Medicaid program. And so you've got, ironically, the poorest folks are left out in the cold in terms of the benefits of the Affordable Care Act. You've got in Texas right now, the eligibility standard for getting Medicaid coverage is 18% of the federal poverty level for parents. In states like Alabama, it's less than 1/4 of the poverty level. Even in states like Pennsylvania, which you would think is a more liberal state, it's only 1/3 of the federal poverty level for parents. And for non-parental adults, singles and childless couples, in all of the states that have refused to implement the Medicaid expansion, if you're single or you're a childless couple, you're ineligible for the Medicaid program, irrespective of income. So I would say, in terms of the broader issues of distributive justice, we've got so much to do just in terms of the Affordable Care Act to reach this very poor population. So ironically, take Texas, I mentioned their eligibility standard for parents maxes out at 18% of the federal poverty level. So for parents between 18% of poverty and the poverty level, there's nothing for them under the Affordable Care Act. It's only one for those families with incomes above the poverty level, up to 400% of poverty, that they get a significant benefit. So we've got so much to do in health care. The minimum wage fight will continue to be fought. I don't know what's going to happen in Washington. I'm not overly optimistic about Congress increasing the minimum wage. I do think we're going to see significant changes at the state and local level. I think that's where the battles are going to be won with respect to the minimum wage.
So let me ask you to go out on a limb. So right now, 25 states are part of the Medicaid expansion plus the District of Columbia. So by 2019, how many states would you predict will be part of the Medicaid expansion?
All of them.
All of them. 50 out of 50 within 5 years.
Yeah, I do think, when the Medicaid
What
program...
makes you so optimistic?
A number of reasons. Number one, when the Medicaid program began in 1965, it wasn't a mandatory program, and a number of states held out. Arizona held out the longest. Ultimately, they all came in. But there's something really different about the way the Affordable Care Act structures the Medicaid expansion, even with the Supreme Court's decision, that gives lots of reason for optimism.
To see more of this interview with Ron Pollock, please go to hsph.me/voices. Thank you for joining ACA this week.